Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, Questions 1 to 12. You hear a doctor talking to a patient called Mrs. Smith about Alzheimer's disease. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Smith. How are you today?
Good morning, Dr. Ellis. I'm doing okay, but I've been a bit worried lately.
I'm glad you came in. What's been on your mind?
Well, it's about my memory. Over the past few months, I've noticed that I'm becoming more forgetful. I sometimes forget where I put things, and there are times when I can't recall names or events that should be easy to remember.
I see. When did you first notice these memory issues?
It started around 6 months ago, but it seems to be getting worse. At first, it was just little things, like forgetting to turn off the stove or where I left my keys. But now, it's more frequent, and it's really starting to worry me.
Have you noticed any other changes, like difficulty finding the right words when speaking or feeling confused in familiar places?
Yes, actually. Sometimes I find myself struggling to finish a sentence because I can't find the word I'm looking for, and there have been a couple of times when I've felt disoriented while driving in my neighborhood.
That must be quite distressing. Have there been any changes in your daily routine or mood?
I try to keep things as normal as possible, but I have noticed that I'm more anxious than I used to be. I get frustrated easily, especially when I can't remember something simple. My daughter says I've been more irritable too.
I understand. Have you had any issues with performing everyday tasks, like managing finances, cooking, or taking medications?
Yes, I've had a few close calls. I've forgotten to pay bills on time a couple of times, and last week, I almost took the wrong dose of my medication. My daughter is helping me more with those things now.
I see. Has anyone else in your family noticed these changes?
Yes, my daughter, Emily. She's the one who urged me to come see you. She's noticed that I repeat myself more often, and that I sometimes seem confused.
It's good that Emily is supportive. Do you have any family history of memory problems or Alzheimer's disease?
My mother had Alzheimer's, and she started showing symptoms around the same age I am now. That's part of why I'm so worried.
I can understand your concern, especially given your family history. It's important that we take these symptoms seriously. Have you had any changes in your sleep patterns or experienced any depression?
My sleep has been a bit off lately. I wake up in the middle of the night and have trouble falling back asleep. As for depression, I've been feeling down, but I think it's mostly because I'm so worried about my memory.
That's understandable. Sleep disturbances and mood changes can sometimes go hand in hand with memory issues. We'll need to run some tests to get a clearer picture of what's going on. It might be helpful to do a cognitive assessment to evaluate your memory and thinking abilities.
That sounds like a good idea. I just want to know what's happening to me.
Of course, Mrs. Smith. We'll take this step by step. I'll also recommend some blood tests to rule out any other conditions that could be affecting your memory. And if necessary, we can discuss seeing a specialist.
Thank you, Dr. Ellis. I appreciate your help.
You're welcome, Mrs. Smith. We're here to support you through this. Let's start with the assessments and we'll take it from there.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Thompson about rusty nail. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Thompson. I'm Dr. Monroe, and I'll be taking care of you today. I see that you've come in because of a nail injury. Can you tell me what happened?
Afternoon, doctor. Yeah, it was a few days ago. I was doing some work in the garden, clearing out some old wood, and I stepped on a rusty nail. It went right through my shoe and into my foot. Hurt like hell.
That sounds painful. Did you get the nail out yourself?
Yeah, I pulled it out right away. There was a bit of bleeding, but I cleaned it up as best I could. I wasn't sure if I should go to the hospital, so I just bandaged it up and tried to keep it clean.
I see. And how has your foot been since then? Any signs of infection or worsening pain?
Well, it's been pretty sore, and I've noticed some swelling around the wound. It's also starting to look a bit red, and it's warm to the touch. I've been trying to stay off it, but it's hard with all the work I have to do.
It's good that you've been keeping an eye on it. The redness and warmth could be signs of an infection. Have you had any fever or chills?
I haven't noticed any fever, but I've been feeling a bit off, a bit more tired than usual, but I thought that was just because I've been working hard.
Fatigue can sometimes be a sign that your body is fighting off an infection. It's also possible that stepping on the rusty nail could increase your risk for tetanus. Do you know when your last tetanus shot was?
I was trying to remember that. I think it was quite a few years ago, maybe 10 or more. I'm not sure, to be honest.
If it's been more than 10 years, or if you're unsure, it's definitely time for a booster. We'll need to get that done today to protect you against tetanus. It's a serious condition that can cause muscle stiffness and spasms, and we don't want to take any chances.
I've heard about tetanus, but I didn't realize it was that dangerous. I guess I should have come in sooner.
It's understandable. Sometimes these things don't seem urgent at first, but it's always better to get them checked out. Besides the tetanus shot, we'll also start you on antibiotics to treat the infection. The redness and swelling you've described suggest that there could be a bacterial infection setting in.
Antibiotics? All right. How long will I need to take them?
Usually, a course of antibiotics lasts about 7 to 10 days, depending on the severity of the infection. We'll also want to keep an eye on the wound to make sure it's healing properly. If the infection doesn't improve in a couple of days, or if it gets worse, we might need to consider a different approach.
Okay. So, just keep taking the antibiotics and watch the wound?
Exactly. Keep the wound clean and dry. You should change the bandage daily or if it gets wet or dirty. I'll also give you some pain relief if the soreness is bothering you. If you notice any pus, increased redness, or if you start feeling unwell, you should come back immediately.
Will do, doctor. I'm usually pretty careful, but I guess I wasn't paying enough attention this time.
It happens to the best of us, Mr. Thompson. The important thing now is to prevent any complications. Do you have any other health conditions that I should be aware of? Diabetes, for example, can slow down wound healing.
No, I don't have any health issues like that. I'm generally in good health, but I do have some allergies to certain medications.
That's good to know. Which medications are you allergic to?
I'm allergic to penicillin. I had a bad reaction to it a few years ago.
Thanks for letting me know. We'll prescribe a different type of antibiotic for you to avoid any allergic reactions. There are plenty of options available, so you'll still get effective treatment.
All right, I appreciate that.
You're welcome. It's always important to mention allergies whenever you're being prescribed medication. Now, after the tetanus shot and starting the antibiotics, I'd like you to come back in about a week so we can check on the wound. Does that sound good?
Yes, that sounds fine. I'll make sure to keep it clean and follow your instructions.
Great. Just one more thing before you go, Mr. Thompson. Are you up to date on your other vaccinations, like the flu shot or the shingles vaccine?
I got the flu shot last year, but I haven't had the shingles vaccine yet. I wasn't sure if I needed it.
If you're over 50, it's a good idea to get the shingles vaccine. It can prevent a lot of pain and complications later on. We can discuss that at your next visit if you'd like.
I'll think about it. Thanks for the advice.
No problem at all. We'll take care of that wound today, and I'm sure you'll be feeling better soon. Take care of yourself, Mr. Thompson, and don't hesitate to come back if you need anything.
Thanks, Doctor. I appreciate your help.
You're very welcome. Take care, and I'll see you next week.
I will. Have a good day, Doctor.
You too, Mr. Thompson.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse urgently updates a doctor about a patient who is experiencing a severe asthma attack. Now read the question.
This is Emily Dawson. She's come in with a severe asthma attack. She has a history of chronic asthma, and this isn't the first time we've seen her in this condition. The last time she was here, we managed to stabilize her with a nebulizer treatment and oxygen therapy. But today, she's very anxious and struggling to breathe, which is making it difficult for the inhaler to be effective. Her anxiety seems to be exacerbating her symptoms, making the situation more critical. We may also need to monitor her oxygen levels closely, as her breathing is quite labored.
I see. So, would you suggest starting her on a nebulizer right away, or should we administer a bronchodilator first? We need to ensure we're addressing both her immediate symptoms and any underlying factors that could worsen her condition.
I believe we should start with the nebulizer immediately. The bronchodilator can be added if she doesn't respond well within the first few minutes. Given her current state, time is of the essence, so a quick intervention is crucial.
Now look at question 26. You hear a medical professional explaining a diagnostic procedure to a colleague. Now read the question.
Let's discuss the treatment plan for Mr. Jenkins in Ward 3.
Sure. I was thinking we might need to adjust his medication because of his age. He's not responding well to the current treatment.
That's one possibility. What do you think is happening with his respiratory symptoms?
Well, It could be pneumonia, but his cough doesn't seem severe enough.
True, pneumonia is possible, but let's consider something more common for his age. What other respiratory issues could be affecting him?
He does have a history of smoking, so maybe chronic bronchitis?
You're close. Chronic bronchitis is a consideration, but think about something simpler that could explain his shortness of breath.
Could it be something like COPD?
Yes, COPD could be a factor, but his symptoms seem less severe. What might he be experiencing that's less severe, but still impacts his breathing?
Maybe just a mild exacerbation?
Right, a mild COPD exacerbation.
Now look at question 27. You hear a nurse provides a detailed update on a patient's health. Now read the question.
We have Miss Gloria Hanson, a 65-year-old woman who underwent a left knee replacement yesterday afternoon. Her incision site is clean and dry with no signs of infection. Post-operative observations are stable. Her temperature is 36.8 degrees Celsius and her blood pressure is 130/85. She's had her first session of physiotherapy and she managed to walk a short distance with assistance. Pain management has been effective. She's been given paracetamol as prescribed and it's controlled her pain well. Miss Hanson is scheduled for discharge tomorrow morning, but before she leaves, she'll need a follow-up appointment with the physiotherapist in 2 weeks. Could you please arrange that for her? Also, I've printed some recovery guidelines for her to read through before discharge, but I haven't had the chance to discuss them with her. Additionally, it might be beneficial to ensure she understands the importance of adhering to her physiotherapy routine at home to aid in her recovery.
Now look at question 28. You hear a doctors discuss the challenges in organizing a health seminar. Now read the question.
How's the preparation going for the upcoming health seminar on diabetes management?
Overall, it's progressing well. We've received a good number of registrations, so I'm pleased with how our outreach efforts have paid off. However, we're encountering some issues with securing high-quality educational materials. Given that these attendees are dedicating their time to improve their knowledge on managing diabetes, I want to ensure we provide them with the best resources possible. Do you have any recommendations on where to source top-notch materials?
Absolutely. That's a significant concern. I'll reach out to a few colleagues who might have contacts for specialized diabetes educational resources. We want to make sure everything is up to standard.
Thank you. I really appreciate your help with this. Your connections could make a big difference in the quality of the seminar, and I'm sure the participants will benefit greatly from the enhanced content.
Now look at question 29. You hear a discussion between a doctor and nurse on a medication. Now read the question.
Excuse me, Dr. Mitchell. I wanted to have a quick word about Mr. Thompson's blood pressure medication. The one you prescribed for him last month, lisinopril.
Yes, for his hypertension.
That's right. He's been on 10 milligrams daily for about 4 weeks now. However, he mentioned to me during his last visit that he's been feeling unusually lightheaded, especially when standing up. He also said he's had some persistent dry cough since starting the medication.
Those are known side effects of lisinopril. It does cause a cough in some patients, and the lightheadedness could be due to a drop in blood pressure. We might need to reassess his treatment plan.
I was thinking the same. I'll review some alternatives and bring them to your attention later today.
Sounds good. Thanks for bringing this to my attention.
Now look at question 30. You hear a doctor provides a patient with treatment plan. Now read the question.
Now, the good news is that we don't need to use steroids for this, so we won't be going down that route. Instead, I'll be recommending a daily application of a moisturizing cream. It's called Emollient X, and I'll write it down for you because it's usually more affordable to purchase over the counter. This cream is actually the first line of treatment for eczema at this stage. I hope you don't mind this bit of scribbling.
That's perfectly fine, thank you.
Right. So you'll apply this cream twice daily, ideally after showering while your skin is still slightly damp. Most people tolerate it very well, but about 1 in 100 may experience some mild irritation. If you notice any irritation, stop using it, and we'll need to explore other options. Let's give it a try and see how it goes, but I'm confident this will help manage your symptoms effectively.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor giving a detailed presentation on atrial fibrillation. You now have 90 seconds to read questions. Hello, my name's Dr. Sarah Miller. I'm a cardiologist, and today I'm going to talk about a common heart condition called atrial fibrillation, often abbreviated to AFib. Let me explain a bit about this condition. AFib is a type of irregular heartbeat, or arrhythmia, which can lead to blood clots, stroke, heart failure, and other heart-related complications. Many people with AFib might not even realize they have it because the symptoms can be mild or easily mistaken for other conditions. However, untreated AFib significantly increases the risk of stroke. In fact, it's responsible for around 15 to 20% of all strokes. AFib occurs when the electrical signals in the heart's upper chambers, known as the atria, become chaotic. This causes the heart to quiver or fibrillate instead of beating normally. This irregular rhythm disrupts the blood flow, which can cause clots to form. If a clot travels to the brain, it can block blood flow, leading to a stroke. One of the key symptoms of AFib is palpitations, or an irregular heartbeat. Patients often describe it as a fluttering sensation in their chest. Other symptoms include fatigue, shortness of breath, and dizziness. However, as I mentioned earlier, some individuals may not experience any noticeable symptoms, making regular checkups vital, especially for those at higher risk. AFib is more common in older adults, and the risk increases with age. It's also more prevalent in people with underlying conditions such as hypertension, diabetes, or heart disease. Lifestyle factors can contribute as well, with obesity, excessive alcohol intake, and sleep apnea being notable risk factors. Interestingly, studies have shown that stress and even caffeine might exacerbate AFib symptoms in some patients, though the evidence is mixed. Let me share a case I encountered recently. A 68-year-old man named John came to see me after experiencing episodes of what he described as a racing heart and breathlessness. These episodes were sporadic, and he hadn't thought much of them initially, attributing them to stress at work. However, during a routine checkup, his primary care physician noticed an irregular heartbeat and referred him to me. After conducting an ECG and monitoring his heart over 24 hours, I diagnosed him with paroxysmal AFib, where the irregular heartbeat starts and stops on its own. John's case is a good example of why AFib can sometimes be tricky to diagnose. Because his episodes were intermittent, it wasn't immediately clear that AFib was the cause. However, once we had the diagnosis, we could start discussing treatment options. For John, lifestyle changes were the first step. He was advised to reduce his alcohol intake and lose weight. We also started him on a blood thinner to reduce his risk of stroke, which is crucial for AFib patients. When treating AFib, it's important to consider the broader impact on the patient's life. Many people with AFib live in fear of having a stroke, which can cause significant anxiety. Some patients may even limit their physical activity, worrying that it could trigger an AFib episode. That's why it's essential for healthcare providers to offer not just medical treatment, but also support and reassurance. Counseling can be very helpful for patients who struggle with anxiety related to their condition. In addition to lifestyle changes and medication, some patients might require more invasive treatments. For instance, if medications don't adequately control the AFib, we might consider cardioversion, a procedure that uses electrical shocks to reset the heart's rhythm. In more persistent or severe cases, ablation therapy, which targets the heart tissue causing the irregular signals, can be an option. Each treatment plan needs to be tailored to the individual, considering their overall health, the severity of their AFib, and their personal preferences. Let me also mention the importance of monitoring AFib over time. Even if a patient's symptoms are under control, AFib can still pose a risk. Regular follow-ups are crucial to ensure that the treatment is effective and that the patient's risk factors are managed. For instance, keeping blood pressure in check is critical, as hypertension can worsen AFib. Patients also need to be vigilant about any changes in their symptoms and report them to their healthcare provider promptly. Another case that comes to mind is a 52-year-old woman named Lisa, who was referred to me after experiencing unexplained fatigue and dizziness for several months. She had no significant medical history, but she was under a lot of stress due to her demanding job. Her initial tests didn't reveal anything conclusive, but an extended heart monitor showed that she was having episodes of AFib that coincided with her stress levels peaking. This case highlights the need for thorough evaluation, especially when symptoms are vague or attributed to other causes like stress. Lisa's treatment focused on stress management, which included counseling and incorporating regular exercise into her routine. We also discussed dietary changes, such as reducing her caffeine intake, as there was a suspicion it might be contributing to her symptoms. Although caffeine's role in AFib is still debated, in Lisa's case, reducing her intake appeared to help. In summary, AFib is a common, but potentially serious condition that requires careful management. Early diagnosis, appropriate treatment, and ongoing monitoring are key to preventing complications such as stroke. Patients need to be proactive in managing their health and should work closely with their healthcare providers to tailor a treatment plan that addresses not just the physical aspects of AFib, but also the emotional and lifestyle impacts. Extract 2. Questions 37 to 42. You hear a doctor giving a detailed presentation on rapidly evolving landscape of healthcare. Now, read the questions. You now have 90 seconds to read questions.
Hi, I'm Dr. Emily Carter, and today, I'd like to explore the rapidly evolving landscape of healthcare, particularly how technology is reshaping patient care and diagnostics. With the rise of digital health tools, telemedicine, and AI-driven diagnostics, we're witnessing a profound shift in how healthcare is delivered. The future of healthcare is not just about curing diseases but preventing them and ensuring a better quality of life through continuous monitoring and personalized care. One of the most significant changes we've seen is the integration of telemedicine into everyday healthcare. Before the pandemic, telemedicine was a convenience. But now, it's a necessity. Patients can consult with their doctors from the comfort of their homes, reducing the need for in-person visits, especially for routine checkups. This shift has made healthcare more accessible, particularly for those living in remote areas or with mobility issues. The convenience factor cannot be overstated. Imagine a patient in a rural area, hours away from the nearest hospital, who can now get expert medical advice via a video call. However, there are concerns about the impersonal nature of telemedicine. Some argue that it lacks the human touch, the personal connection that is crucial in a doctor-patient relationship. I believe that while telemedicine does change the dynamics of patient interaction, it doesn't necessarily diminish the quality of care. In fact, it allows doctors to follow up more frequently and provide care that is more in line with the patient's lifestyle. The key is finding a balance between technology and human interaction, ensuring that patients still feel heard and cared for. Let's delve into diagnostics, another area where technology is making waves. Traditionally, diagnosing conditions has been a time-consuming process, involving numerous tests and specialist consultations. But now, with advancements in artificial intelligence, we can diagnose certain conditions much faster and with greater accuracy. Take radiology as an example. AI algorithms can now analyze imaging scans and detect anomalies that might be missed by the human eye, especially in the early stages of disease. This doesn't mean radiologists are becoming obsolete, far from it. Instead, they are evolving to interpret AI findings,
making the final diagnosis more precise and informed by the best of both human and artificial intelligence. Cardiology is another specialty that's being transformed by technology. Wearable devices, like smartwatches and fitness trackers, have moved beyond counting steps. They now monitor heart rate, detect irregular heartbeats, and can even predict the likelihood of a cardiac event. These devices continuously collect data, which is then analyzed by sophisticated algorithms to provide insights into a patient's heart health. This real-time monitoring allows for earlier intervention and personalized treatment plans. Cardiologists now have access to a wealth of data that wasn't available before, enabling them to make more informed decisions and tailor treatments to individual patients. Now, let's talk about mental health, a field where digital tools are making significant strides. Mental health apps are becoming increasingly popular, offering everything from meditation guides to cognitive behavioral therapy exercises. These apps provide support to those who might not have immediate access to a therapist, helping them manage their mental health on their terms. But while these tools are beneficial, they should not replace professional care. The human element is critical in mental health treatment. Digital tools should be seen as supplements to, not substitutes for, traditional therapy. Finally, let's consider the role of genomics in personalized medicine. With the cost of genome sequencing dropping dramatically, it's becoming more feasible for patients to have their genetic information analyzed. This data can help doctors predict how a patient might respond to certain medications or what diseases they may be predisposed to. In oncology, for instance, this information can be used to design highly personalized treatment plans that target specific genetic mutations within a tumor. This approach not only improves the effectiveness of treatment but also reduces the risk of adverse reactions. So, where does all this leave us? My conclusion is that while technology is indeed changing the face of healthcare, it's doing so in a way that complements and enhances the human touch rather than replaces it. We are moving towards a future where healthcare is more proactive, personalized, and accessible. However, we must ensure that in our pursuit of technological advancement, we do not lose sight of the importance of human connection in medicine. The challenge for healthcare professionals will be to integrate these new tools while maintaining the empathy and compassion that are the cornerstones of good medical practice.
That is the end of Part C. You now have 2 minutes to check your answers.